Let me tell you about the realities of a national healthcare system. We've lived with one for 60 years in my country. And the first thing is that you are terrified of ending up in a national health hospital. 7,000 people died last year, 7,000 identified cases, heaven knows how many others, from afflictions that they picked up in hospital unrelated to the condition which they entered to have treated. Our hospitals are dirty places. They're places that you have to queue to get into. People frequently die while waiting for operations. Now look, these things can be easily anecdotal, right? Everyone can say, I had a good or a bad experience. But what is not anecdotal is the empirical data on these survival rates. You know? If you get prostate cancer in the United Kingdom, you are 4 times as likely to die as if you get it in the United States. If you get breast cancer in the United Kingdom, your survival rate is a quarter of what it is in the United States. Ditto for heart disease, ditto for stroke, ditto for surgery. Right? I don't know whether you've seen that film of Michael Moore's where he sort of waddles around saying that life expectancy is lower here. Yeah, life expectancy may be lower for a whole bunch of reasons to do with street crime and so on. What actually matters is what are your chances once you have been diagnosed with a disease? And they are better. Anybody would rather fall ill here than in Britain. So you might say, well then why do you keep this crazy system of yours? But when it is so obviously not working, when it so obviously led to all of the things that we know socialism leads to corruption and to rationing and to inefficiency, why do we do it? And the answer is, once you have it, it is almost impossible to get rid of. The National Health Service is the 3rd biggest employer in the world, after the Chinese Red Army and the Indian National Railway System. 1.4 million people work for the NHS. The overwhelming majority of those are administrators, managers. A minority are doctors and nurses. And yet, human nature being what it is, we are always more easily scared of the prospect of loss than we are enthused by the prospect of gain. And so people now feel trapped, almost like a battered wife, into sticking with what they know. And when, in a Fox interview a few weeks ago, I suggested that you would be making a mistake to follow us, within about 3 minutes, the British Health Minister was on television saying, how dare Daniel Hannan attack our hard-working doctors and nurses? Of course, I hadn't been attacking our hard-working doctors and nurses. Indeed, I hadn't even attacked any lazy doctors or nurses who were out there, which statistically presumably must exist. All I had said is that we might have a better way of doing it, but even that is, is considered unforgivable in the United Kingdom. Almost anything else you can get away with, All manner of sins and blasphemies shall be forgiven unto men, but the blasphemy against the Holy Ghost shall not be forgiven unto men, and the blasphemy against the Holy Ghost in the British context is to say anything critical of this massive employer because it has so many vested interests. So once you get this, my friends, you won't be able to get rid of it. It's all very well to say, oh, it'll just be, one more system that sits alongside all the private ones. That isn't how it will work in practice. You will end up where we are, with a state committee making decisions that are literally life and death decisions, decreeing which treatments, which medications can be made available on the system and which ones not. And that, if you wanted to think of the one thing that was most antithetical to the vision of your 3rd president, you couldn't come up with something, a clearer example than a national state bureaucracy having this terrifying, awful power to decide who lives and who dies.